Today we are discussing importance of about the culture reports for the patient management in the ICU setup. ICU patient management, why the cultures are important first. In the ICU, the patients are very different compared to the patient in the ward. You know, the ICU patients usually they are critically ill patient, so they have multiple organ failures. They can have hemodynamic instability. Also at the same time they can have immunosuppression. And also in the ICU the organisms also differ. Usually the organisms which are in the ICU are very high resistant organism, and the way of medication behave is also different in ICU patient because they have some organ dysfunction. At the same time, the pharmacokinetics of the drugs also can change depend on the patient condition. Okay, what are the issues of using the empirical treatment? Usually we know when the patient arrives to ICU, those are critically ill patients, so we are trying to and we always start some high-end antibiotics to save the patient life. Usually we starting with meropenem or piptas, piperacillin tazobactam in those sort of conditions, but it's acceptable in the early presentation, but we always should consider the escalation of the treatment once the patient is improving, and when the culture reports are available and the drug we are using is not the drug the patient need. And also at the same time, if we're going to continue the same drug during the once the patient is stable, and at the same time the drug is not the ideal drug, what happened in the ICU setup, they develop resistance. That is how we are losing those high-end antibiotics. The other thing we are doing in ICU setup is we are usually over-treating the colonization. Once we receive the positive culture report, without thinking furthermore, we used to give antibiotic just in our head. What we are thinking is we don't want to lose the diagnosis, and at the same time we don't want to lose the patient. So because of that we used to give antibiotic even for the colonization. In all those conditions, ask from yourself when you see the culture report whether this organism causing the tissue invasion and whether this organism is causing any systemic infection. If your response is no, then no need to give antibiotic just because the bacteria are hang over the area. Usually the ICU patients are heavily colonized. We can give some common examples also. So what are the common things we are misleading and mistreating in the ICU setup? One thing is the candida and respiratory samples. Usually almost always it's a colonization. So no need to treat those sort of infection. And Acinetobacter positive in ET secretion. This is the most common culture report you will ever come through when you are doing the ICU appointments. Just because of Acinetobacter is there in the ET secretion, no need to treat unless the patient is having features of ventilator associated pneumonia such as rising CRP, whether the patient is having fever, whether the patient is having chest X-ray changes, then you have to think and you have to treat the patient. There are several explanations and examples can given for the time when we are treating for the colonization, not for the actual infection. By treating for the colonization and giving antibiotic, we are creating resistance and we are going to lose the most valuable antibiotics we are having. Commensal is our normal flora. Usually this is harmless. This can cause disease in the patient who are immunocompromised. So what is colonizer? Colonizer usually present on body surface and there is no tissue invasion, and at the same time no clinical features of infection such as the features of infection. Patient might have fever, high CRP, those sort of no features of infection, and this does not require antibiotic treatment. So then what is infection? Infection, there is through pathogen. So there is an organism, and for that organism, due to the tissue invasion, there is a host response. Because of that, the patient develops symptoms and signs such as patient can have fever, patient can have organ dysfunction, patient can have hemodynamic instability, those sort of things. And at the same time, the inflammatory markers will be elevated. CRP, ESR will be rising. And at the same time, this need antibiotic therapy. So, we will see you in the next lecture, the continuation of this one. So, now you know when to give antibiotic, when not to give antibiotic.